Good evening, everyone, and welcome to the lecture on how your job is killing you. Before we get started, I'll tell you how I came up with this lecture. You can see in that picture up there, there's the asphalt crew outside of my old office paving the street there. And I looked at it, I watched these guys, and I see them all in this plume of smoke of asphalt. I thought to myself, what could that possibly be doing to their health? If you look at that, what that is polycyclic aromatic hydrocarbon. Yes, that's a mouthful. But each one of these guys, if they have stress, if they smoke cigarettes, or they drink alcohol, it quadruples their chance of getting pancreas cancer. So that picture right there is what stimulated this seminar tonight to tell you about how your job is killing you. Before we get to that, we're going to talk about some other stuff, so bear with me. So Dr. Jeff's next lecture is Health Begins Before You Wake Up. That's June 1st at 7:30 p.m. You're not going to want to miss that. Our fearless leader, Dr. Tent. It's written all over your face. That'll be December 7th at 7:30. You don't want to miss that one either. That'll be a fantastic lecture. Doxy. This is the way for you to reach out. This is the way to reach your relatives, your friends, your family that might be in different states, that might be struggling with their health, struggling to determine what to do with their health. We do a lot of Doxy daily where we help people all over the world, as a matter of fact. So this is our platform that we use. It's kind of like Zoom or Skype, and it works fantastic. This is how you can connect with the office: Instagram, YouTube, Facebook. Tell your story. We like people to come in, tell their testimonials of success they have with the office. Again, it's another way to reach out to those people out there that might be struggling with their health and want to find that difference in health, want to find that different way to get healthy. We do these testimonials, and it helps them to find that doctor that they need to help them with their struggling health. So share your story at the office when you're in. Don't forget, you can follow us on different social platforms. We're on Rumble, we're on TikTok, we're on Gab at Diverse Health. Let's get started. These are my three daughters, and if you see, Dr. Tent and I and Dr. Jeff talk about the tough girls in the world today. These are my tough girls. The three of them, that's Shelby, Lexi, and Brooke. And basically, people have asked me at my church, they said, you know, what's the difference? What is it with your kids? How come they behave well? How come they're so healthy? What book do you read? What psychologist do you follow? Who do you listen to? I said, we don't do any of that. What we do is nutrition. We raise these kids nutritionally. We've started them prior to even birth on nutrition while they're in the womb and all the way through. When they're young, I put them in their bottles. I put iodine. I put flaxseed. I put all the vitamins. To tell you the truth about the kids, none of these kids are vaccinated. They're all good in school. They're A-B students. I don't have to ask them, or I never had to ask them to study. They go upstairs. They study on their own. Never had trouble with them. A healthy child means a healthy brain, healthy body, and a smart child. They do fantastic. My oldest one now runs her own little company on internet. She's selling jewelry. She's doing fantastic. And here's another big reason why. Diet, germs, exercise, sunrise, and fresh air. Outdoor is an advantage for kids that leads to a lifetime of good health. I think we did an injustice by keeping these kids inside playing thumb hockey on their phones and not getting out in the world. Your body, whether we like it or not, is filled with millions upon millions of independent and codependent microorganisms. Many of these germs and bacteria, which have taken up residence in your body, have set up their own little ecosystem called the microbiome. A little bit of one kind and a less of another can result in possible catastrophic changes to your health. A healthy microbiome can only be possible with ample exposure to bacteria and germs. Remember those days, folks out there? Remember catching the tadpoles, the frogs, chasing the gardener snake? You'd see a group of little boys over there. What are you doing? They'd be chasing the gardener snake, running around with it, chasing the girls. This was health, picking up turtles, getting dirty, rolling in the mud. That's how you build this microbiome. I don't know if you're aware of it, but 72% of your immunity comes from right here, your guts. If you're not out getting exposed to viruses and bacteria and these different germs, you're not building it. Children who are not allowed to grow their internal microbiome tend to suffer from these kind of conditions: diarrhea, obesity, anxiety, and allergies, and many more. According to a new study conducted by researchers who were working with the Children's Hospital in Pennsylvania and Ohio, the act of cultivating healthy gut bacteria in newborns mice led to strengthening of their ability to fight off pneumonia. Through this, and they have concluded that the exact same thing can be true of humans. Babies' microbiomes play a huge role in that baby's health and immunity from a young age all the way to adulthood. The process of a child's microbiome begins immediately after birth. While inside the womb, a baby has virtually no microbiome yet, but as soon as they leave the womb, they develop this microbiome. How is that? As they're vaginally delivered, what happens is bacteria go in through the mouth, the nose, and they start that process of building that microbiome. This is how we build that immunity. Social media is isolating the teens. We missed one there? No. Social media is isolating these teens. Like I said before, they're all in playing thumb hockey. Doctors warn parents about the serious risk of with heavy smartphone use. Heavy smartphone use is linked to an increased rate of social isolation, depression, suicide thoughts, and even suicide. 92% of the teenagers out there own a smartphone. We see this daily. We see kids coming in. You've never seen kids with this kind of stuff going on, where they have the depression, the anxiety, the social pressures between Facebook, TikTok, YouTube, all the different things creating these social pressures. They're not outside playing like they used to. We used to play freeze tag, kick the can, red light, green light, all these things. Kids need to get out. Evolution of the immune system. More than 1,600 genes are involved in an innate and adaptive immune response. The immune system is relatively immature at birth and has to evolve during a life of exposure to multiple foreign challenges through childhood. The immune system is fully mature at the age of 13. Ask that of your local pediatrician. The immune system isn't fully mature until the age of 13. Does vaccines really make sense? 2, 4, 6, 8 months of life. This is when these children are getting these vaccines with an immune system that's not completely developed. So we're throwing in foreign proteins, heavy metals, cow plasma, and other things, viruses that are attenuated when their immune system is not completely developed yet. Remember, it takes the age of 13. That doesn't make sense to me. More chemicals, fewer words. Exposure to chemical mixtures during pregnancy alters brain development. Here's what they found in this study. Researchers have provided evidence that complex mixtures of endocrine-disrupting chemicals impact children's brain development and language acquisition. With their novel approach, the scientists showed that up to 54% of pregnant women were exposed to experimentally defined levels of concern. While exposure levels for individual chemicals are often below limited values, exposure to the same chemicals in complex mixtures can still impact the health. In other words, individually, each chemical by itself could be at a normal level, but you put multiple chemicals together, and the next thing you know, it's affecting the brain development of these developing embryos. A mixture of chemicals in the blood and urine of pregnant women was identified in the Swedish pregnancy cohort Selma, associated with delayed language development in children at 30 months. This critical mixture included a number of phthalates, bisphenol A, and perfluoride chemicals. Now, what are these? Phthalates are chemicals added to plastic that increase flexibility, transparency, and durability. The bisphenol A chemical is in plastic that mimics estrogen activity in the body. And this one here, the fluoride chemicals, used in everyday products to prevent stains and food from sticking to surfaces. One of the main areas, or the key areas of hormone pathways affected, is the thyroid hormone. This is precisely why I tell a lot of pregnant women, make sure you check your thyroid monthly. As most of you know, if you've heard my past lectures, you know that my youngest child was born without a thyroid. When she was first born, we were told she probably would never be able to speak, she probably wouldn't be able to hear. If you look at her now, she's doing fantastic. She's my boarding queen at Mount Brighton. She snowboards like crazy. She's almost as tall as I am already at the age of 14. She's an AB student at the local high school, and she's doing fantastic. What was the difference? The nutrition that we put into her. But you have to check these thyroids. These pregnant moms out there, they'll do the ultrasounds month to month, but you really should be checking these thyroids, because one of the things that makes the thyroid sluggish is pregnancy, besides other things like chemotherapy, radiation, and other viruses. So don't forget to check those thyroids. The researchers were able to show that 54% of children included in the Selma study were at a risk of delayed language development at the age of 30 months, as they were prenatally exposed to mixtures of chemicals at levels that were below the levels predicted to impact the neurodevelopment. This risk did not become apparent when the current limit values for individual chemicals were used. So again, individually, each chemical could be at a normal level, but a mixture of several chemicals would have an impact or effect on the brain. So we need to stay away from these chemicals, these plastics, when we're pregnant. Oop. Here's the universities that did this study. The study has shown a connection between mixtures of different chemicals and the child's gender development, respiratory problems, cognitive development, and growth during childhood. Child gender development. Are they born with it, or is it a chemical thing? Here's what I like to use. This is the pregnancy protocol I like to use. Omega-3 EPA DHA, your essential fatty acids, your vitamin-mineral complex, the minerals that you need 60 minerals to develop the embryo, the amino acids, you need 12 amino acids to develop the embryo, and here's one that I throw in the Cardio Plus. You put a heck of an afterload on the pregnant mother's heart when she's pregnant. So I always throw in the Cardio Plus. Now the Cytozyme H up here at the top, I discovered this through one of my patients, Erica. She came in and she had that defect in the child's heart that they determined that they were going to have to do surgery after the delivery. They said there's no way around it. You're going to have this surgery. She's very upset. She came into the office. She said, is there anything that we can do possible to help this situation? I said, well, Cytozyme H is kind of like a stem cell transplant for the heart. What it is neonatal calf heart, one-to-one relation with our heart. I said, let's put you on 10 of these a day, every day. So we put her on 10 a day, every day, from month number 5 all the way to the end of her pregnancy. That child is now 10 years old and has never had the surgery. So that healed up the heart, that or the Lord. Now, only 13% of the parents think they're doing a good job helping the kids eat healthy. And we're building up to something I want you to know for the parents out there of these children. Nearly all parents agree with the importance of healthy diet. Only a third of the parents of children ages 4 to 18 are confident that they are doing a good job shaping their child's eating habits. Only 1 in 6 rate their child's diet as very nutritious. This came out of University of Michigan, C.S. Mott's Children's Hospital. Common challenges get in the way: price, picky eaters, and convenience. Hospital food nutrition mirrors an unhealthy lifestyle. How many of out there have seen the uncle or the neighbor or somebody that has that heart attack or that event in the hospital? You go up to visit them and 45 minutes later they're feeding them coffee and pudding and this stuff. Last time I checked, the coffee has caffeine, a heart accelerant. The pudding is all sugar. But this is the kind of diets that even heart attack victims are being fed 45 minutes later. Most U.S. hospitals are in budgetary and service crisis. Therefore, institutionalized foods are often easier to manage than meal preparations from scratch, a parallel to many household situations. A study published in the Journal of Food Service in October 2006 states that the common practice of overeating hospital food or overheating hospital food served the patients can reduce the vitamin C, an important marker for nutrition content, by up to 86%. It's also depleting the other vitamins as well. Fast food restaurants at children's hospitals influence parents to feed their family unhealthy meals. New research states that up to 59 of the nation's 250 children's hospitals have fast food restaurants as part of their cafeteria options. 17% of the U.S. children are considered obese. Common nutrient deficiencies in the U.S. cause these: diabetes, inflammation, dyslipidemia, gastrointestinal problems, ADHD, fibromyalgia, fertility, anxiety, fatigue, adrenal fatigue, hypertension, autism, headaches, depression, hypothyroid, and weight management problems. 9 common nutrient deficiencies in the U.S. Nearly 10% of the people in the U.S. have nutrient deficiencies. Failing to get key nutrients can lead to a variety of health problems, including fatigue, night blindness, osteoporosis, high blood pressure, acne. The most common nutrient deficiencies are these: calcium, essential fatty acids, magnesium, vitamin A, B12, C and D, folic acid, and iron. So let's look through them. Calcium. Calcium is an important building block for strong bones. It also is essential for nerve and muscle conduction or heart function. Nearly 70% of Americans fail to meet the recommended daily intake of calcium, which is due to either inadequate intake, rich foods, or to poor absorption. I'd probably go on the record to say poor absorption is the bigger problem here. If we don't have that hydrochloric acid in the stomach, we're not absorbing that calcium. Now, where do we get a loss of hydrochloric acid? Well, we see a myriad of people out there today that are on anti-acid pills. They're on Prilosec, Tagamet, Protonic, on all these different medications that get rid of the acid in the stomach, which creates a hypochlorhydric effect, which means they can't absorb that calcium. Other things that will compete with the calcium: caffeinated beverages, alcohol and soda, dark leafy greens, beans, and whole grains. So here's the calcium products I like to use and why. The Osteo B is probably a great product to absorb the calcium. It's not really a calcium supplement. It's more to help process and absorb the calcium in the body. It's a great product for those people that can't get that absorption. Then we have the CalciFood, which is a great bone builder with the BIOS. The CalMel Plus, which has parathyroid in it, along with the other Calcium Magnesium Plus from Biotics. Those are all great calcium products that we use in the office. Essential fatty acids. Essential fatty acids are important for making hormones, regulating blood clotting, keeps your blood slippery, inflammation response, and contraction and relaxation of the arteries. Essential fatty acid deficiencies occur when omega-3 consumption is low. Symptoms include scaly skin, brittle hair, cracked nails, and acne. Here's some of the essential fatty acids we use, or I like to use in the office. The omega-3 EPA DHA, I like that especially for the pregnant moms out there. This one for memory and mood. Flaxseed works great for breasts. Omega-3 EP or optimal EFAs works fantastic as well. And remember what we say around DHS, we like to mix those oils up. We don't like to just go with one. We like to mix them up on a day-to-day basis so you get a little bit of each and how they work. Folic acid plays a role in maintaining healthy red blood cells and important during pregnancy. Folic acid helps to prevent that neural tube defect in these pregnant moms so that we don't have the spinal bifida in the kids. Women with low folic acid stores have greater chance of developing this. So here's some of the folic acids that we... Oh. Can we get that back to folic acid? Okay, here's some of the folic acids that we like to use. Vitamin B6, B12, and folate. I like this one especially also for those people with the homocysteine, with the heart conditions. We use this to bring down the homocysteines. I love to use the Forto B12 for women that have that anxiety that ramps up to that fatigue. Reason why is because the fortyl B12 contains the tillandsia herb, which helps to relax the nervous system, and then it's got the B12 to give them that energy. So if they got that nervous energy or anxiety that ramps them up to fatigue, I'll use that one. Folic acid B12 from Standard is a good one. I like the Folate 5 Plus because it's a methylated form of the B12 folic acid. And then the B12 2000 is great. It's a lozenger, sublingually absorbed, and I use that a lot with the kids. It also works great, B12 folic acid will work great with those kids that have a little bit of ADD. It's a lozenger, it has a good taste, they'll tend to chew it or suck on it, and then it gets absorbed through the gums. Iron. Iron deficiency are caused by inadequate consumption of iron foods or poor absorption. Again, here's another case where people take the anti-acid drugs. They're going to have a hard time absorbing iron. You have to have the hydrochloric acid in the stomach to absorb the iron. So those people that are taking Prilosec and Prevacid, they're going to have a hard time absorbing their iron. Now, what we see with iron anemia is general fatigue and headaches. If you've ever had low iron, you'll find out that that's one heck of a headache that you'll get. If you don't have the prodrome, I'd suggest you probably have an iron deficiency. But if you have this prodrome, which is spots in the field of vision, sensitive to light and sounds, that's probably more of a migraine. But don't forget to look for the iron. Iron deficiency usually occurs during development stages in life, such as adolescence, pregnancy, breastfeeding, stomach or intestinal conditions that either cause bleeding or reduce absorption. And again, I'd probably go with the reduced absorption, especially in the older generation. So here's the irons I like to use. Now the CGF is not technically an iron. Why I like that product is it has all the cofactors to help to move iron around the body. So if you have iron in the body and you're not moving it around and you're not putting it in storage or utilizing it, this is the product that I'll use. Typically you'll see somebody in this case that might have a normal serum iron level but have a % saturation that's low or have ferritin in their blood work that's low. That's when I'm going to use the CGF. The Ferrofood is a great whole food iron that I like to use, and the Iron Plus is fantastic as well. It's a liquid iron, works quite well. Magnesium. The most deficient mineral in the United States is magnesium. Magnesium is a central mineral that affects hundreds of metabolic reactions in the body, within the body, including regulating muscle, nerve function. Symptoms are muscle cramping, abnormal heart rhythms, unexplained numbness, and high blood pressure. I especially like magnesium for the women. They have menstrual cycles, and when they have their menstrual cycles, they lose more magnesium than they do iron. So this is a home run for preventing the cramping or the contractions of the uterus during menstrual cycles for the cramping. Also helping women with constipation, it does wonders. So here's the magnesiums I like to use and why. This one here is a home run for those people with restless legs or the cramping after physical activity. I like it because it has the calcium, magnesium, and potassium in it, which is a home run for that restless leg woman. This straight magnesium here, this is the one I use if they have constipation or if they have heart palpitation. I love the Easy Mag 2 just for general magnesium need and no constipation. And then if they need the vitamin C, I'll use the calcium, I'll use the vitamin C Cal Mag to hit all three. Vitamin A. Vitamin A is essential in the replacement of skin cells and for maintaining optimal vision and a healthy immune system. For this reason, those with a vitamin A deficiency are at an increased risk of acquiring a severe infection. Night blindness, skin irritation, stomach growth, racing heart, and viruses. Why viruses? Well, vitamin A reacts with silver. Well, silver reacts with vitamin A to make it function against viruses. So it's a great product. And now here's why this one is really good that I like to use. This one right here by Biotics, because it's emulsified, which means it's broken down into the smallest micron. Now what that means is it bypasses the liver. So you can use this one on the children, the smaller kids, and not affect the liver. You can use it on people that might have a liver condition, and it's not going to have that impact on the liver that most vitamin A will have. So the emulsification of it makes it fantastic for helping these young kids with viral conditions. B12. Vitamin B12 helps to form the red blood cells, enhances neurological function, and provides building blocks for your DNA. Those most at risk for B12 deficiency are the vegans, people with intestinal problems that limit their absorption. Again, that's where hydrochloric acid also binds to the B12 and absorbs it, just like it does the iron and the calcium. Adults for the same reason. Adults run into hypochlorhydria, which means low acid in the stomach, and they can't absorb these things. Those taking long-term heartburn medications, as I mentioned before, pale skin, shortness of breath, and mood changes when you're the symptoms of vitamin B12 need. So again, here's the B12s I like to use. I explained them earlier. The same goes for each one. Vitamin C. Vitamin C is your antioxidant, the Linus Pauling thing. Antioxidants provide an electron to balance out those clouds, to make them neutral. When you're low on vitamin C, bleeding gums, easy bruising, weakness, fatigue, rashes, and difficult with wound healing. The C's we like to use, or I like to use, are the C complex by Food Research, the Bio C1000 by Biotics, and C complex. Usually in our office, what I'll do is I'll muscle test to see which one works best for the patient, and that's the one I'm going to use. Vitamin D, probably one of the most underplayed nutrients. Vitamin D is unique in that most vitamin D can be produced in our bodies when exposed to adequate amounts of UVB radiation from sunlight. Vitamin D key role is to regulate calcium absorption. Those with a vitamin D deficiency are unable to absorb the calcium and in turn strengthen bones. However, vitamin D has several other important roles for overall health, including supporting bone health, cardiovascular health, testosterone, and immune function. This is the one I think is underplayed the most, is immune function and what vitamin D does for it. Don't forget also, you have to have healthy kidneys to absorb this vitamin D through the skin. Another thing to remember is this. If you're slathering on all those potions and lotions, suntan lotions with parabens in them, you're blocking your ability to absorb the vitamin D, and you might potentially put yourself at a higher risk of cancer with the parabens. With the vitamin D, the kidney has to secrete something that will allow that vitamin D to be processed through and with sunlight through the skin and be absorbed. As you absorb it, this is what happens. Well, this is the D I like to use, the Bio-D emulsion. Usually 1 drop would provide 2,000 IUs of vitamin D. But this is an important thing for the immune system here. You have what we call a D binding protein. If you remember years ago, they talked about vitamin D and cancer. And it's that D binding protein with the 3 sugars attached to it that when we get sick or we have cold or a flu, cancer, virus, whatever it might be, we make T and B lymphocytes. Now, what each lymphocyte does is it'll cleave off a sugar. That'll render this molecule over here called GCMAF, which is a glycoprotein macrophage activating factor, which activates this cell right here, which is the macrophage, which goes through phagocytosis, or it gobbles up like a Pac-Man everything from viruses to bacteria to even cancer cells, and then digests it. Now, if we have a virus or we have cancer, the byproduct of those existing within our body is called a nagalase enzyme. That nagalase enzyme will break down this. It'll break down the production of the GCMAF. So a lot of times you have to override that with extra vitamin D. But if you don't have the vitamin D in your system, you can't make this. Now, most medical facilities or people that run blood work will say if your vitamin D is above 30, you're fine. That's not in the literature. What's in the literature is your vitamin D levels need to be 60 or higher. And I'd go on the record to say if you're fighting a cancer, you're probably going to want to be around 80 to 90 in your vitamin D levels in your blood. But just above 30 is an empty tank. You need to be above 60 to form the immune system and make this work. That's how I feel about vitamin D. It's very underplayed. Moving on. Molds and yeast common in daycares for kids. What they found is this. According to a new study, certain buildings and the number of children in the daycare influence the species of fungi found within, suggesting that many of the molds and yeast probably have indoor sources. The study was motivated by the rise in chronic allergies and asthma. Fungal growth can lead to poor indoor air quality, and some fungi are associated with allergic reactions and respiratory symptoms that may lead to chronic respiratory diseases. It has been shown that the concentration of fungi in daycare centers is higher than that in homes. So, talking about this, what I like to use is the probiotics. The Floral Bites I use for the young kids because it's fantastic, it's got a good flavor, it's chewable, and they like it. It's easy to get in them. You have to be careful because if you leave that out, they'll eat several of them and end up with diarrhea. But that's an easy one to get into the young kids. The Pro Symbiotic I do with the older kids, which is a pre and post probiotic. Then the ADP, I use an oregano oil. We don't use the ADP on kids, but I use an oregano oil that we can individually determine how many drops for each child to put in to break down the mold and yeast. Now, asthma, I like these two a lot. Breath of Life is one of my go-tos for bronchitis, for asthma in kids. I usually dose it depending on the weight of the child, but I've never seen anything work quite as well as that Breath of Life for asthma in children. The Cyzyme AD is the adrenal gland, which sits on the kidneys, and what that does is make the epinephrine, and basically the epinephrine relaxes the smooth muscle of the trachea so they don't go into that asthmatic attack. It's very important with the asthmatics. Now, boron also will go after yeast. Boron, another thing about boron is it'll push calcium into bone, so that's a good thing because usually we use melatonin to put calcium into bone, but boron will push it to bone too. And then Pneumozyme is a great long-term protector of the lungs. It's what I call a stem cell transplant for the lung because you got neonatal lung tissue in there, and it works fantastic. Now, here's the thing that a lot of mothers have asked for a long time. What can we give these young children that are still either A, nursing, and we pump the milk and we can bottle feed it, or they're being formula fed? Here's a home run for the kids. The Cryo Food Powder and the Vitaminerals. I like to use about a half a teaspoon each a day for the children. This is that home run that you mothers out there are looking for to keep your kids healthy or give them that fighting chance, along with a good probiotic like Floral Bites. This is a great way to build that microbiome that I was talking about that builds that immunity. Let's not forget, like I said before, 72% of your immunity is developed right here in your guts. Very important to build that microbiome. Another way the FDA wants to keep you unhealthy. Unfortunately, sometimes the people we think are holding our hands and leading us towards health are actually standing right in our way. The FDA threatened cherry growers in 2006 for promoting cherries for health properties. Just cherries. A distributor has been threatened with getting shut down just promoting the scientifically backed health benefits of walnuts. The FDA modus operandi is to lie and twist parsed legalese against beneficial real food and supplement firms. A California-based walnut distributor was threatened by the FDA recently for promoting scientifically factual health benefits of walnuts. The New England Journal of Medicine and the American Heart Association have published studies citing walnuts' heart health benefits. But they wanted to shut him down. Here's the letter they sent. Based on claims made on your firm's website, we have determined that the walnut products are promoted for conditions that cause them to be drugs because these products are intended for the use in the prevention, mitigation, and treatment of disease. You're no longer allowed to prevent. What a shame. The FDA is censoring real whole food companies' true health information from the public while allowing both junk food and children's cereal companies to promote their products as heart healthy and nutritious. The false claims are on their packages and detailed with clear ad copy on their websites. Boycotting pharmaceuticals and junk foods will be more effective than pleading and arguing with the government to rein in the FDA, especially with the former Monsanto top executive Michael Taylor now in the White House. How big pharma broke American healthcare? In an interview with Russell Brand about his new book, Sickening, author, physician, and legal consultant John Abrahamson told Brand that opioid crisis was one of the biggest disgraces the drug industry has ever known. It happened because drug companies literally lied about the addictiveness of the drug in order to make huge profits. They're standing in your way. They're not leading you in the right direction. So, back to the microbiome and PCOS in women, because we see a lot of polycystic ovarian syndrome is what that stands for. This is another reason why we want to build the microbiome in women. They found that the women with PCOS have elevated testosterone levels due to less diversity in the bacteria in the gut. Women who have polycystic ovarian syndrome tend to have less diverse gut bacteria than women who don't have the condition. The findings indicate women with PCOS tend to have less diverse portions of gut bacteria, and a trend which appears to be linked to elevated testosterone levels. The recent studies have also shown a decline in the alpha diversity of the gut microbiome in women with PCOS. We used to treat this a lot with just hormones and balancing hormones, but now you got to consider the microbiome even for the women with the PCOS. Since we're talking about testosterone, we'll look at this. Now, many times before you've heard me say men with testosterone or taking testosterone really have to check the aromatizing pathway, because if the aromatizing pathway is active, which means they're converting testosterone to estrogen, they run a higher risk of prostatic cancers, which is true. And I beat that up with several seminars. But here's the foods that will affect testosterone. 5 foods that lower testosterone. Alcohol, that's one of them. Breads and desserts and pastries. Soy products, the non-fermented soys. Dairy products. Now don't forget dairy products. They say that 2 1/3 cups of milk a day will increase your risk of prostate cancer by 34%. That was written by Johns Hopkins. You can find that at pcrm.org. Certain fats, and an Asian Journal of Andrology found that the type of fat you consume can influence your testosterone levels and function. Consuming trans fats may lower testosterone, and consuming too many omega-6 fatty acids may reduce testicular size and function. Now, aging, a sedentary lifestyle, and here's the big one I want you to see. Chronic drug, marijuana. What do we see a lot of? It's like prohibition. We have all of these dispensaries now, and everybody from grandma to your teenager is wanting to do an edible or smoke pot. Now, what happens with this is it will lower testosterone levels. So that guy or woman that's doing that might start to feel things like emotional upset, things like that. I'll tell you about a patient that we had, a nice young man, about 17 years old, football player that was being scouted by D1 schools. Now, what happened in this case is he was so stressed out because imagine this, in today's world, the coaches talk to the kid, not to the parents like they used to, or not as much, and they're texting with this child and kind of, I guess you pressuring him, would you want to come here, want to come there? That's a lot of pressure on a 17-year-old to make a decision for the rest of his life. So he had all this pressure. He's a 4.0 student, does very well in school. So what was he doing to deal with the anxiety? He was smoking pot. When we ran his blood work, we seen patterns of not only that, but patterns with blood sugars and other things that we eventually balance out. And I told his parents, he's smoking pot. He's doing a lot of pot, because there's no way that a D1 scouted athlete should have low testosterone at 17. He had 345. He should be somewhere up around 800, 700 to 800. He was 345. We called him out on it. He admitted that that was the case. We stopped that. We found something else for his anxiety nutritionally. We balanced his blood sugars. We balanced the B vitamins because kids like to eat what? A lot of trans fats. They like to eat a lot of refined carbohydrates that will affect everything from your B vitamins, which will eventually affect your blood sugars, throw off your Krebs cycle and everything else. So once we got rid of the marijuana, once we balanced out all the nutrition and then put him on some testosterone supplements, what did we get? We got the smiles back. We got the happiness back. We got the kid that used to be happy about everything back. He signed with the D1 school. I'm fortunate to tell you this kid will probably step foot on a professional football field one day in his life. He's a great kid. He basically interviews well. He's got everything that every athlete wish he could have, and now better because we balanced the system. Testosterone effects on the body. It promotes and increases in bone and muscle mass along with body hair. That's another thing that they'll do. These scouts came in on him, ripped up his pants and said, no hair growth on the leg, he's going to get bigger. I never heard that before, but that's what they did. It affects reproduction, and it helps the male genital mature during adolescence. It is necessary for sperm production. Low testosterone can cause bone density loss. Here's another thing that he was experiencing. Fractured a bone in his hand. He has a pin. He fractured another bone in the finger. So he had fractures. So you can guarantee that those fractures that are occurring are going to stop too. How to boost testosterone naturally. Exercise regularly, following a balanced diet that includes fresh, healthy foods, maintaining a healthy weight, sleep well every night, keep your hormones balanced by avoiding foods that lower testosterone like soy and certain types of fats, and live a healthy lifestyle to maintain your overall health. They all just died suddenly. What happened to Bob? What happened to Bob? Well, the neurosurgeon said this. This is significant trauma. This is something I find with someone who has had a baseball bat to the head, or who has fallen from 20 to 30 feet. It is not a mystery surrounding what Saget hit his head on, but why he fell so hard. Perhaps his podcast on December 13 provided a clue when he says, I went to the pharmacy the other day, I got a booster shot, and I should have gotten it in my arm, but I got it in my butt, so I'm in a little pain. That doesn't make sense. Maybe this is what happened to Bob.
I don't mean to. I don't mean to brag, I don't care, but I want you to know, double vaxxed, booster, flu shot, and I'm gonna be honest, I have the shingle shot too. And I still get my period. What? Yes! Traveled, went to Mexico twice, did shows, meet and greets, never got COVID. Clearly, Jesus loves me the most. Seriously. So nice, so nice.
That was a real fall. You heard what she said in the beginning. When she fell as hard as she did, she fractured her skull. Maybe that's similar to a baseball bat to the head or a 20 to 30 foot fall. I just wonder if maybe that was part of what happened to Bob. Virginia governor ends mandatory carbon dioxide poisoning of children, mask in school. It's about time. Senate Bill 739 requires Virginia schools to make masks optional by March 1st, and no parent can be required to provide a reason or any kind of certification of the child's health. The bill also states that there can be no adverse disciplinary or academic consequences for the students and if their parents elect for the child to go to school without a mask on. Thanks to Virginia Governor Glenn Youngkin, children enroll in a public school, elementary, and secondary school can breathe normally again without inhaling carbon dioxide all day, while also avoiding brewing bacteria in their mouth, throat, and lungs from the oxygen-restrictive face coverings. Parents are in charge of their children's health again. Praise to the new governor. He probably knows more than some of the microbiologists out there from that. So let's get into the jobs and how the jobs are killing us. Now, chiropractically, a lot of chiropractors years ago have been bottlenecked into being back pain specialists. I will say we are back pain specialists, but that's not how chiropractic started. The first chiropractic patient had a hearing deficit, Harvey Lillard, and Dee Dee Palmer treated him and helped him with it. You have a brain and spinal cord. The brain is housed in the cranial vault, the skull. Spinal cord runs down through the center of the spine. You have two nervous systems within a nervous system. You have a parasympathetic and a sympathetic, and the spine can be adjusted by manipulation. You can affect how that spine carries signals to the rest of the body through the spinal nerves. Every cell, tissue, and organ in your body is stimulated by a spinal nerve somehow, some way. So when we're adjusting the spine, not only are you dealing or helping with back pain, but you're regulating the nervous system to every cell, tissue, and organ in the body. That has a lot more to do than just back pain. But in this case, we're talking about back pain as one of the occupational hazards. So 10 jobs that cause back pain. Drivers, 1, construction workers, nurses and healthcare providers, office workers, manual laborers, dentists and dental hygienists, warehouse and distributor workers, auto mechanics, factory workers, and baby care. A lot of people in the U.S., back injuries make up 20% of all workplace injuries and illnesses. And I can tell you, if all 20% of the people in the population sought out chiropractic, we'd have a double line around the building and you wouldn't get in for anything else. So, drivers, it's because they sit in the same static position all day long, don't change their seating. Construction workers are climbing, lifting, pushing, pulling, repetitive motions. Office workers are sitting in the same bad posture possibly all day long. As you sit, your extensor muscles get weak, so you go into that slunched over posture. Manual laborers, repetitive tasks, lifting heavy loads, bending and twisting. Dental hygienists and dentists, they're bent over in that static position all day long doing those micro movements, working on the teeth. That'll lead to back pain. Warehouse and distributor workers, they're on their feet a lot. They do lifting, they do pushing, they do pulling of merchandise and equipment. Auto mechanics are bent over the car, working on the motors, putting themselves in odd positions all day long, trying to repair that car. Factory workers are doing repetitive motion again, and baby care. A lot of mothers go through this. We see it all the time. The mothers deliver their baby, and they start to say to me, "Why do I have all this back pain all of a sudden, Dr. Gill? I'm getting back pain like crazy. I've never had back pain." Think of the ergonomics of the car seat. Think of the ergonomics of lifting the pack and play, the diaper bag, and everything else that comes with bearing children. That will get their back a lot of times, and they'll need chiropractic care. But lifting these children too will throw out the back. The oopsie doopsie and throwing the kid up in the air, that'll get your back every time. So I thought I'd show you a little compilation of the adjusting that we do here, or that I do at the office. Once you get adjusted, you'll realize how much of an impact the adjustment has on your nervous system. Several people will come in and they'll say things like, I have better eye-hand coordination in softball or my sporting event. No longer do I have that sciatic pain. You took care of that earache. Even right down to my child had a fever when I came in 2 weeks ago. You adjusted my child's atlas sacrum and the fever was gone by the time we got home. That's how I experienced chiropractic. I grew up in the field. I started when I was 2 weeks old. I never had a pillar shot in my life, just like my kids. And trust me when I say, I can attest for this because my 91-year-old mother, who still gets treatments, still takes her nutrients. We were down in Florida to see her a few weeks back. She's literally diving headfirst into the pool. Most people at 91 and a half are on a walker, slobbering on their chin, and barely can get around. And she's still diving in the pool, doing fantastic. I'd trust that over anything. Work burnout and emotional eating. Overworked employees often adopt unhealthy habits that cause weight gain. A study published in the Journal of Health Psychology found a surprising link between work burnout and developing unhealthy habits and led to weight gain. That's pretty common sense. You get stressed out, you'll see people will eat more. According to the National Heart, Lung, and Blood Institute, more than 2/3 of working adults in the U.S. are considered overweight or obese. It's a big problem in America. Too many carbs and sugars. It stimulates the serotonin and some of those brain receptors, and it's a feel-good thing. Top 10 jobs with the highest rate of depression. Oops. Public and private transportation, real estate, social services, manufacturing and production, personal services, legal services, environmental administration and waste services, organization and association administration, security and commodities broker, print and publishing. Here's one of the things for all blood types for depression that's over or underplayed is that biodemulsion. I usually like to do about 10,000 IUs a day with the people that have depression. Here's another one that we have to have as our base formula for helping the brain and working with depression. Your essential fatty acids. I love the cod liver oil, especially with memory. The Pro DHA 1000 is great, omega-3, and remember what we say about our oils. You should mix them up day to day. Here's a great one for blood type A's and B's. Most blood types will do good on the B's. I think all will do good on the B's, quite honestly, from what I've seen. 5-HTP works really good on the A's and B's. St. John's, the reason why I won't use it on a blood type O is it affects their monoamino oxidase, and it'll make them feel kind of funky or weird. So I don't typically use the St. John's for the blood type O's. In fact, not at all. I'll use the Mintran on all blood types too. That works really good, especially the ABs in the A's. It works fantastic for. The 5-HTP being tryptophan with calcium magnesium will help to make serotonin, which kind of relaxes you, helps with the depression. Remember, it's the selective serotonin reuptake inhibitors. What they do is poison that enzyme in your brain to maintain the serotonin levels at the postsynaptic gap. So if you do 5-HTP, what does that do? It raises up your serotonin and it has similar effect. Now, for type O's, and I'll explain these out, L-tyrosine is part of the dopamine pathway. If the dopamine pathway is really weak, I'll go to the Dopatrophic Plus. This is a great product that helps with that deep sense of pleasure. Blood type O's do fantastic on it, but a lot of times you can play this L-tyrosine and it'll get to the dopamine. Rhodiola and ginseng, for the type O's that are super stressed, it takes a lot to get them super stressed, but once they get super stressed, they push past the dopamine pathway, start to make the catecholamines. It's the rhodiola and ginseng that'll put the smile back on their face and make them happy. That's a home run. So those O's out there that feel flat, they're just not that happy person anymore because of their stress being so high, I'm going with the rhodiola and ginseng. Of course, the vitamin D. Here's another home run is the Cytozyme PT-HBT because it'll balance their moods. O's will go through that roller coaster effect of mood swings. 1 minute crying, the next minute angry. It's the Cyzine PT-HPT that does wonders for them in that category. And then here's this. We see a lot of type O's that have diverticulitis, colitis, ulcerative colitis, and sometimes Crohn's. It tends to be more popular in the blood type O group. Dysmucine granules, a half a teaspoon of GI Resolve will balance out that digestive system. And remember the gut-brain connection. If the gut's off, the brain will be off. If the brain's off, it'll affect the gut. So this is where we can balance that in the blood type O's. Depressed for the ABs, I'll use usually the methylated B12s, the 5-HCP again, the Mintran is really good for them, and of course you can use the St. John's as well. Could your job rob you of vitamin D? More than 3/4 of indoor workers and 72% of healthcare students were also vitamin D deficient. Medical residents who are known to work very long hours were more likely to be sunshine vitamin deprived than doctors, nurses, and other healthcare professionals. Very few indoor workers actually get good vitamin D levels. And remember, you want to keep from slathering on those lotions and potions with all the parabens in them. The best way to get the vitamin D in the sun is out there, direct skin penetration for about 15 minutes. You'll get 10,000 IUs. That's all you need. Cover back up. You're not going to get any more after that. Night shift workers and cancer. What does it mean for workers? The National Toxicology Program recently released a report about how persistent night shift work is related to cancer. There is a high confidence that persistent night shift work that results in circadian rhythm disruption can cause human cancer, and that night shift work is probably carcinogenic to humans, based on evidence from breast and prostate research, laboratory animals, and the mechanism of how cancer develops. Have you ever fell asleep with the lights on? Have you ever fell asleep with the TV on? What does that do? That affects your melatonin. Melatonin is produced at night in the dark. When you have all these lights on, what happens is you'll decrease that melatonin. That'll affect your immunity. There's even in the literature now with that funky virus going around that says that melatonin will help you fight against that virus. It's in the literature. Look it up. So when you fall asleep with the TV on, the lights on, and you wake up, you have that groggy, irritable feeling, it's because you're monkeying with your circadian rhythms through the melatonin. Get the lights off, get sleeping. These nurses that come in that work midnights all week long, and then try to go back to the normal hours of the weekend. I don't know if you've other doctors out there have seen it, but they're constantly fighting sickness. They're constantly trying to get their emotions under control. It's this pattern that we see that they're throwing off, the circadian rhythms. Workers at night have the highest risk. These are the criteria. Night shift work of at least 3 hours between midnight and 5 a.m., frequent night work, 3 or more nights per week, long-term night shift, 10 hours or more, beginning night shift work in early adulthood before the age of 30, workplace social stressors, and lifestyle choices. Healthy practices for those at highest risk. Get enough sleep, eat nutritious diet, exercise regularly, avoid tobacco, limit alcohol consumption. So here's the vitamin D that we use. I'm going to bypass that. Let's go on to this. Occupational risk and chronic kidney disease. This was a population-based survey, studied 91,340 participants in the U.S. who complete the National Health Interview Survey 2004 through 2008. The likelihood of developing chronic kidney disease was 4.3 times higher in respondents working in buildings, ground cleaning and maintenance occupation was 4.4, healthcare practitioners and technical occupation 4.7, transportation and material moving occupations, and in computer and mathematical occupations 4.8 times higher, production operations 5.3 times higher, food preparation and serving related to occupations, and 6.1 times higher in healthcare support occupations, and legal occupations. You can probably pretty much guarantee that maintenance one and outdoor use is probably dealing with the Roundup and the glyphosates in that condition. The leading cause of chronic kidney disease include poorly controlled diabetes, hypertension, chronic glomerulonephritis, and polycystic ovarian disease. Other risk factors are old age, cardiovascular disease, smoking, obesity, hyperlipidemia, chronic urinary tract infections, malignancy, and socioeconomic status. Reports on occupational risk factors have focused on the exposure to nephrotoxins, including lead, mercury, glycol ethers, organic solvents, copper, chromium, tin, mercury, welding fumes, silicon-containing compounds, and grain dust. So, what do we use for those kidneys and that chronic kidney prevention? Cytozyme KD is like the kind of the stem cell transplant for the kidney. Got neonatal kidney tissue in it. Gaminol Forte, which is gamma orzonol, is a home run for those with the low GFRs. I like to use these two together where on blood work we see the high BUN, the high creatinine, and the low GFRs. These work fantastic. The outside one that a lot of people don't think of is the CoQ10, which I use the CoQ100, that works fantastic. The Renafood is a must along with the Cytozyme KD, Albaplex, and Renal Plus. I like the Renal Plus because it has the hyponic acid in it from cranberries. It also has uva-eucerin in it, which is a slight diuretic that works fantastic. Do occupational factors influence the risk of colon and rectal cancer in different ways? The incidence of rectal cancer is much higher than the incidence of cancer in any segment of the colon of comparable length. Rectal cancer risk is increased by a high consumption of alcohol, particularly beer, 3 to 6 a day, and colon cancer risk is increased by sedentary work. A tendency towards an increased risk of colon cancer was observed for persons with more than 20 years of sedentary work. Consistently, more than 20 years of physically active work significantly decreased the risk of left-sided colon cancer. For rectal cancer, a significantly decreased risk was found for more than 20 years in sedentary work, and a tendency towards increased risk was seen for those with more than 20 years of physical active work. So, here's what I like to do to protect the colon. Chlorophyll, since 1954, when it came out, was touted as one of the best things for cancer. I think it has its place, and it works fantastic for the colon. Vitanox, curcumin, is not only good for the colon, but it's great for the pancreas cancers. Curcumin is one of the top things for that. I love that curcumin and the green tea in there. The vitamin D is a must for anything wrong in the colon. If you study the literature, you'll find you have to have vitamin D in most or all, I'd say all, your colon cancer patients. Dismucine granules is fantastic for regulating and balancing out the colon, and the selenomethionine works good too. I would particularly, I'd use all of these for for prevention and protection of the colon. These 10 jobs are most likely to give you a heart attack. 10 jobs mostly give a heart attack. Community and social services, transportation and material moving, architectural and engineering, building grounds, cleaning and maintenance, personal care and service, office and administrative support, management, construction and extraction, computer and mathematical, education, training and library, installation, maintenance and repair. Centers for Disease Control and Prevention includes a significant study on cardiovascular health status by occupational group, which broke down the jobs that are most likely to cause heart attacks. The study was conducted using data from 21 states, which utilized a telephone health survey of about 66,000 respondents and used the American Heart Association Life's Simple 7 cardiovascular health metric as a benchmark. So here's what we do to support the heart. Cardio Plus Cardiotrophin. I use this one if we have somebody that has a weak heart and basically can't exercise. I like the cardiotrophin for that individual. I love the Cardio Plus for the active person. Cataplex B is a must. Vitamin B6, 12, and folate I use for those ones that have the high homocysteine, which is that genetic factor that causes plaquing in the arteries. I see that to bring down the homocysteine quite well. Another one that I talked about earlier tonight, the CGF, brings it down even faster because the cofactors are indeed B6, B12, and folic acid, as well as others for that iron support. But the CGF and that together are a home run for bringing down that homocysteine. And then the Bio-3-BG with the high thiamine works fantastic for heart conditions to get those B vitamins in. If they got a tachycardia or racing heart, I'll use Land and Sea minerals, or I'll use the organic bound minerals from Standard as well. Heart health, if they're non-methylators, I'll use the Folate 5 Plus or the 5-MTHF. Oils that I'll use, of course, we mix the oils. These are the oils I showed you earlier: flaxseed, omega-3, pro-DHA, cod liver, optimal EFA. Mix your oils. Makes the blood slippery, and when the blood's slippery, it can't clot. Occupations with increased risk of pancreatic cancer: printers, copy machine repair, battery makers, die makers, candle makers, rubber makers, cement workers, and jewelers. The association between occupational exposure and pancreatic cancer remains controversial. A meta-analysis on occupation and pancreatic cancer suggests that some occupation exposure, chromium, nickel, selenium, organic solvents, polycystic or aromatic hydrocarbons, as in those people that work with asphalt, and organochloride insecticides may increase the risk of the neoplasm. What's the new thing about pancreas cancer that's come out in the literature? What are the main symptoms, the two main symptoms that indicate possible pancreas cancer? One is increased thirst. Now, in the past, thirst was always attributed to the pituitary hypothalamus, but they're saying the increased thirst is a sign of possible or potential pancreas cancer. The other one is bleeding into the colon. That's another sign of the pancreas cancers as well. Yellowish skin, pigmented skin, that's another one. So what do we use to protect the pancreas? The enzyme, intenzyme fortase, the proteolytic enzyme, which will take the stress off the pancreas. We use some B6 Plus, which is not up here on the screen, from Biotics as well. The dysmucine granules, the vitamin D, and simple pancreas I'll use. But another one that I'll use is beta TCP. A lot of times you have to be careful because if you throw a stone from the gallbladder down the bile ductwork and it blocks that sphincter of Oddi, all of those fluids will back up and affect that pancreas. So a lot of times I'll use the beta TCP to thin out the bile to keep that moving along. Sometimes we'll use some phosphood liquid to break down a stone if we suspect a stone possible. "15 jobs that can damage your vision." Welder, cell phone service repair, chemical lab tech, administrator, data analysis, lifeguard, ER nurse, electrician, automotive tech, archaeologist, crop workers, manufacturer, machinist, food processor worker, truck driver, construction worker. Now, besides this, let's remember those nice sunglasses that block the UVB light and that protect the lens of the eye and protect the eyes. So don't forget your eyewear too, the sunglasses in the summer to protect those eyes. But here's what I like to feed the eye: the Cruciferous Complete, the Complete Eye by Foods, Cyruta Plus with the vitamin C, the rutin, and the Eyeplex to protect the eye, strengthen the eyes. What type of occupations can lead to carpal tunnel, which is a big one in people that do repetitive movement? We all know, the doctors out there know the Tinel's and Phelan's test. We all know that the pain that they wake up in the morning in their wrists We all know the numbness that they'll get in their hands and that as well. What happens is that median nerve runs through that carpal area, gets impinged, and then it causes that carpal tunnel. The medical field will open up the wrist. They'll cut that transcarpal ligament to open that up. A lot of times what you have to do is increase their B6 need using B6 phosphate to increase the synovial fluid, which is kind of like the oil is to a car. It lubricates all the parts, so as those tendons are moving back and forth with each other, they don't get that friction, rub, and inflammation that'll also irritate that median nerve. But who is most common for this is your chefs, your bakers, office workers, seamstress, cashier, assembly line workers, hairstylists, musicians. Carpal tunnel syndrome is a condition that causes tingling, numbness, and weakness in the hand. It is also known as a median nerve compression. Even employees who work in different industries may still suffer from this type of work injury. The median nerve runs, like I said, through that wrist area, through that carpal area of the wrist. Carpal tunnel syndrome occurs when pressure on that nerve goes through a passage in the wrist called the carpal tunnel, and it ends in the hand. Symptoms include tingling, numbness, a burning sensation, a lot of times at night as they're sleeping, weakness in the hand, difficulty holding and grasping objects, shock-like feeling that moves into the fingers, and stinging that travels up the arm. Sometimes it'll go all the way to the shoulder. A lot of times you can manipulate the bones in the wrist, put them on the B6 phosphate, even work on that elbow. A lot of times the elbow will be out of alignment and it'll falsify and give you symptoms of carpal tunnel when you really don't have carpal tunnel. Just a friendly reminder, we currently are experiencing stock issues and delivery delays like most of the United States. Most time there are alternatives to the current products you are looking for. Please don't hesitate to call and ask for assistance and help. However, if there is no replacement, we kindly request your patience. We are doing everything possible to make sure our diverse health family has everything available as soon as it enters the building here. Thank you for shopping local. Continue to shop local. Support your local businesses. And thank you for a great night. I hope you learned a lot from this seminar on how to take better care of your health. God bless and have a good night.